feels like my pelvis, AKA I'm calling them my vagina bones, are getting ripped apart. So we have a physical therapist / porn star, the best combo on the planet. Cherie Deville, thank you so much for joining us today. Appreciate it.
Thank you so much for having me. And yes, pregnancy, your body's preparing for birth. So your body's sending out those chemicals that tell your ligaments, the things that hold your bones together, to relax in preparation. Unfortunately, that also makes your muscles need to hold tighter. And one of those muscles in the buttocks, the piriformis, sort of lays over that sciatic nerve. So when your muscles say, let's keep it together, your sciatic nerve goes, crashed. So that's kind of where you're at.
Thank you. Finally, I've been Googling all sorts of stuff. I'm like, why is this happening? I'm falling apart. I think the baby's head's coming out like a month early. No,
Girl,
that's
good.
What it is.
It's
Thank
totally
you.
natural. It just sucks really bad. You might consider, your doctor may have shown you those pelvic belts for pregnant women. Yeah, it can kind of assist your muscles in doing the job they're trying to do now that your ligaments, the things that are supposed to be holding things together, are getting you ready for that really natural moment of childbirth.
Oh yeah, I'm prepping. But you think
the moment that Kate is definitely ready for and totally not scared about
not
ripping her
freaking
taint
out
over
at all in any way.
They'll just snip it and sew it back together. You'll have
stop. Don't even start going on this, because the entire episode will be about her taint now that you mentioned it once.
But we will get, so I've already done it to her because I want to ask her about this later down the line. I'm sure on set, like everybody has a nurse in their family or some sort of someone in the medical profession who we're sitting down the shore on family vacation. And everybody's like, hey, Jerry, I got this thing on my hand. Can you look at it? Like on porn sets for you? And I want to get into your background and everything, but I guess we'll just jump into the physical therapy aspect of it.
Let's do it.
On porn sets for you, does that happen? Do you get people coming up to you like, my groin, I'm about to shoot and my groin's not working right? Like,
oh yeah. I mean, everything. I've seen everybody's anal fissures. Because a lot of us, we work for ourselves. We're independent contractors. So healthcare isn't provided by our company. We're ourselves. So some of us have chosen, like me, to have health insurance and others don't. So it's nice to have a friend to be like, girl, go to the doctor, or, well, you know what I mean? Like at least to like kind of triage the problems.
And so you doctorate in physical therapy, and you didn't get into the porn business until you were in your 30s, right?
That's correct. Yeah.
Do you mind giving us a quick, I'm sure everybody asked you this, but a quick background on how that all came to be?
I know. It still surprises me, actually, because I mean, I love physical therapy. I was not bored of it in any way. And physical therapists make good money. But I started doing a little bit of nude modeling on Model Mayhem, which is really just amateur models and, for the most part, amateur photographers that network on that site. So I was doing that for spending money, basically. Mm-hmm. You know, when I was like, I want hair extensions, but I'm a physical therapist. This is ridiculous. So let's, we'll do a job on the weekend. We'll get those shoes. We'll get that hair, whatever it was that I wanted. So I was doing well and ended up getting a few professional shoots, mostly for men's magazines, motorcycle magazines, stuff like that. And I don't know how, but a headhunter for OC Modeling, my current agents, one of Sandra's headhunters found me online and hit me up on Model Mayhem. And I was like, do porn? What? Like, it almost seemed like, oh, me? Like, I was like intrigued, nervous, but most of all, just completely tantalized at the thought of doing something that I would have never known. Like, where would you go to do porn? Like, like how, I mean, yeah, I can go like
one ticket to porn star, please. Yeah. Like,
right. But I'm talking about like LA porn with top companies, like with an agency. So I was like, you know what? Fuck it. I'm going to go. I'm going to shoot my 1 week of shoots she set up for me. And then I'm going to have these, back in the day, DVDs. I'm going to be like, look at what Nana did when she was younger. That was it. It was for a look at what Nana did moment. And that was all.
That's like me. I talk about me in my 20s and I'm like, yeah, for the story, you wouldn't believe the things I would have done just so the next morning at breakfast, I could sit with my girls and be like, so I hooked up with Gritty, the Flyers mascot last night. Like, you
Yes.
wouldn't believe this. So this was kind of like a YOLO, let me just like give this a whirl. It's going to be a one-time thing.
Absolutely. Because like, how do you say I could have done porn? Like for me, how do I look back at 80 and have not done something I had an opportunity to do that's in my mind that cool?
Yeah.
So I did it. And even I, had a ton of, I'll be honest, negative stereotypes about what porn might be.
Mm-hmm.
But I got to LA and I loved it. I loved the people. I loved performing. I mean, I loved my agent, and I was like, this is really fun. So then like 2 months later, I came back, and then I was coming like once a month for a week, and then 2 weeks a month. And then I'm like, fuck it, I'm moving to LA.
Well, I'd say you were coming more than that. So this is why we're in the business.
But I have a question about, like, you started with the nude photos and all that. Was that something that you were doing? Was that like your dirty little secret? Like, I'm doing this on the side and no one really knows, no one in your family knew, and then it escalated to porn and then you told people? Or like, how did that work?
In between. So the nude modeling, to me, I just didn't even think of as a big deal. Everyone was an amateur, and true, I didn't imagine anyone would find out about that. So I didn't tell anyone. But I definitely had this like fantasy probably put in my head by that Girls Next Door show that I was obsessed with at the time.
Yeah, Holly, Bridget, and Kendra,
those
of course.
girls are so cool, So I was like definitely, fantasizing about that like sex work world. But before I actually like shot porn, because I knew it was going to be online, and like, honestly, you can't hide that. That was the moment where I'm like, even though I didn't think porn was going to be serious for me, that line was where I'm like, they're going to find out it needs to be from me. You know what I mean? At least the people I cared about, like close family, close friends.
Who were you worried about finding out first? Were you dating anyone? Are you married, first of all?
I'm not married, and I have been dating someone for 7 years now, but I was dating somebody else. I was actually married to somebody else back then who didn't mind.
Okay.
And so like your close family.
We were swingers, the whole, it was not.
So that's you were already really open about your sexuality, and you already came from a background of like.
Constantly,
That's like what we had Brandy Love on, and she was saying the same thing. I was like, had you ever shot like porn before I ever had sex on camera? And she looked at me and she was like, yeah. She's me and my husband.
On my phone or like with my friends, but like not to sell.
I just think that's so interesting that like the road that people take, and like when they initially cross that line, it's like different people have different points. Like for Brandy, it was like, okay, I'm fine doing this. I'm fine going to clubs. And then like once it becomes professional, then there's that realization that like, oh shit, this is a job. And then once you start making money, it's like, okay, now this is a job. And then you get a little fame. And then it seems like for you and for some of the other people we interviewed, then things really just take off, and then
suddenly you're the internet's favorite stepmom.
Right.
When you were everyone's favorite.
Even if you called yourself that and don't tell,
Yeah, exactly.
Look, I'll be honest. I wrote that while I was high one night, but I mean, I'm known as.
But I wanted to know, like, clearly, just even asking you right off the bat, saying this quick thing about the pains I'm having, and you enthusiastically are like, oh, here's what's going on with you, blah, blah. Clearly, physical therapy is something else you still have a great passion for.
Massively.
And for a while, you were doing both. Once you started doing the videos and stuff like that, you still continued doing was it something that the money in this started to outweigh that, so you fully switched, or do you miss it?
It was more of a time thing, and even though I would say that I'm not really practicing physical therapy, I still do it enough to keep my license.
Okay.
Because that's important to me. I still do all of my continuing ed. I still put in my hours, now in home health because it's the most convenient and flexible. But when I was practicing, I was in sports and spine, like when I was full-time practicing.
Right.
Yeah. And that's it. It was more, I mean, not obviously. That's terrible that I say obviously. Sadly, my vagina makes far more money than my brain.
America.
Yeah, right.
Isn't that a statement? You know what I mean? So it's kind of like, at least now, porn is an aesthetic career. And even though MILFs are a thing, you can still age out of porn. So for me, I'm putting most of my hours into this, which I am thinking of like an athlete as a shorter term career, and then just maintaining my license so that when this career, you know, goes through its natural progression, I can then, you know, transition for the rest of my working years if I want to back into physical therapy, even if it's on a volunteer basis, you know?
Right. Yeah.
Because I would hate to lose my license. Like, I paid a lot for that degree. So
yeah. And the porn probably helped pay it off too.
Yeah.
So,
well, to be honest.
That and more.
Yeah. No, I think that's interesting, like to have a backup plan. Like when we talked to Brandy, she said her backup plan was real estate, which is kind of like, it's like a fickle business that you get into. Sometimes it works, sometimes it doesn't. So to talk to someone like you who has this like expansive like academic background and this medical career, and you seem to have like your head on straight. I mean, it makes a lot of sense what you're telling us. Like I completely get it. Make the money while you can and then go out afterwards and make the physical therapy stuff.
If I'm being honest, my dream pivot would be to use the money that I've made in porn, I mean, not all of it, but a huge chunk, and open a clinic that I've never seen before, which is you see a lot of women's physical therapy, pelvic floor physical therapy geared towards women, and it's always or mostly geared towards urinary and or fecal incontinence, which of course is extremely important and something that, you know, would enjoy helping people with. But what I don't see, which I think is equally important, is a physical therapy clinic that doesn't just focus on women, but it's men and women's, not just urinary, but sexual health.
Right.
Because what we're kind of skirting around in a lot of the physical therapy women's clinics health is, one, both men and women have a pelvic floor that can become weakened. Mm-hmm. And two, it's not just about piss in your pants. It's about men and women, men maintaining and achieving erections has a lot to do with pelvic floor strength. Women, sometimes a lot of the vaginal pain you can have can be pelvic floor muscular tightness. And those things aren't addressed. And I think a lot of it is people are uncomfortable and or shame, but that doesn't mean that there aren't people out there with those needs, and those needs can be met professionally. And I feel like for me, that would be an amazing pivot because I'm extremely comfortable with my body. I'm extremely comfortable with talking about these topics. And if I had a sexual wellness clinic, I really think that it would become popular and help people who are having these sexual dysfunction problems know that it's normal. Things can be done about it. Let's address it. Let's take the shame out of it. Let's talk about sex positions after you broke your hip. Mm-hmm. Let's talk about these things, instead of just having you be like, well, I guess I can't do anal or my pussy hurts so I won't fuck. Like that does not have to be the way, but you need someone who can talk about that comfortably with you.
I love hearing that because it is such a huge thing, and people, I'm like, you only get this one life. And I know people that are letting like years and years and years go by of their life not having sex because they have some sort of pain, or they have, especially, at least on mine, I know some of my friends that are like, it's just XYZ, and they're too embarrassed to talk about it. They're too embarrassed to seek help for it. And I'm like, You're missing out. There's so like, you can really fix this. And I think it's interesting too. I think the disabled community gets overlooked a ton when it comes to sex and sexuality. There are things you can do. We did, I also do a military podcast here, and we went to this gym for disabled veterans where they don't teach you, they don't give you like special equipment or everything. They teach you how to make do with what you've got in front of you. Yeah. And like, so here's what you're stuck with right now. We're going to make the best of it and figure out how to work this equipment for you. I feel like you can do the same thing with sex, and they can still have, because mentally it really does mess with you really horribly if you can't function sexually. Yeah, absolutely.
Food, sleep, and sex. And in America, we won't talk about sex.
Right.
That same disabled person could go to a physical therapist and learn how to use their right arm more efficiently to eat, but they're never going to bring up their sex life. And to me, that is not okay. Mm-hmm. It is our job as medical professionals to create a whole, well human. And if they're not satisfied with their sex life, even if it's just a solo sex life, that's a disservice.
Yeah, absolutely. And you were saying too, it's not just women, it's for men. What are some of the more common injuries? Because we were talking about, I was asking Pat, like gay sex and like
There's a lot to
There's
it.
a lot to it sometimes. And
Yeah.
once you start to enter something and it can get worse and worse and you just start to avoid it, what are some of the common things you see and maybe some common fixes that are like, here's an easy thing to keep in mind if you're having this problem?
And not even, just before you go, not even just to add on to that, like what are the common like issues that people bring up, even non-injury related? Like what are the main concerns that people have, gay and straight?
Yeah, I think, I mean, you guys, at least in my profession, the things that people worry about or talk about when it comes to anal sex are the fear of any kind of stool or feces being shown, right?
Mm-hmm.
The nervousness that'll happen, and the nervousness over discomfort or pain. So to me, those are the two things that people are really, talking about when it comes to anal sex. And what I think a lot of people don't know, well, let's just talk about the pain first. I can't have anal, I'm too tight, it hurts, those are the things you hear a lot. What I think a lot of people don't know is, so I think we can all realize, like, if you do it right now, you can like squeeze your anus closed and kind of relax it open, right? So that's
just did it.
All right.
Yeah,
All
so
right,
that's
hold
it.
on,
the
let me try.
outside ring,
Got it.
right?
Got it. Okay.
And that's under our voluntary control, like in our mind. You can close it and you can relax it. But what a lot of people don't know is right beyond that voluntary, controllable sphincter, there's an involuntary one, controlled like our heart is controlled. I'm not saying beat, 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 breathe, breathe, breathe. There are things our body does for us. And when we're nervous, or our body goes into, you've probably heard it, fight or flight mode, right?
Mm-hmm.
Your nervous system does a lot of things. You might sweat, your heart might beat faster, things might dilate and prepare for you to run. And unfortunately, that involuntary anal sphincter can tighten up when we're nervous. So really, one of the most important things that you can do to have pleasurable anal sex is the relaxation component. If you're heightened and you're nervous about it hurting, or you're moving too quickly, that inner sphincter isn't going to relax. You can't will it to happen. You just have to let your body do it. So what I tell people is two things. One, this seems really counterintuitive, but as your partner is entering you, right, which should be done slowly, or you can do it while you're on top, that's my personal preference so that I'm in control, is you bear down slightly, almost like you're pushing out a firm poop. You know what I mean? Which seems crazy. Why would you push out when someone's trying to go in? But it can kind of fool that sphincter that you do not have control into opening in the way that it's supposed to. Also, just things that you might do to calm yourself down if you are nervous. Deep breathing, foreplay, all of those things can put us, and if you're the owner of a dick, your dick too, in a emotional state that's going to create not just better anal relaxation, but actually a better erection as well. Because when you're nervous, as you might know, that's not the time your body's like, let's fuck. That's the time your body's like, let's kill tigers, So
but what if when you push out, you shit?
You might
Sorry,
shit.
I know that's literally like the biggest fear that I hear.
Yeah.
It is the biggest fear. So I think, well, one, let's talk about anatomy a little bit. So you don't always have poop, right? Like if you were to stick your finger, like the tiniest little thing right on the inside of your butt, you don't always have poop there. You only have poop there unless you have IBS like I do. Yay. You only have poop there when your intestines kind of drain into that lower colon, drain into that anus, and they're ready to poop. So you have between like 2 and 10 hours between the time you eat and the time that is in there. And you can feel it. Like you can get to know your body. So that's not, if you know, like, okay, what I do is I do a little bit of fasting and I do a really gentle rinse, and then I'm usually good to go. I think the mistakes that people make often are too much caffeine, because that speeds up the intestines. It causes it to like come right, to the bottom. Artificial sweeteners can do that a lot too. And then just kind of knowing your intestinal vibe, if that makes sense. Like, are you someone that poops in the morning and then that's it? Well, probably after that poop, you're going to be fine in terms of the cleanliness for those lower 8 inches for quite a while. So if you just put a little bit of water out there to clean out whatever the residual is, you very well might be fine, and you can do that pushing out with no result. But at the end of the day, you are fucking someone in the ass, and a little poop is fine.
Right.
That's the other thing. If you're in your head nervous about a little poop, how is that involuntary sphincter going to get out of fight and flight mode? You know what I mean? And so that's something to think about, kind of becoming okay with that.
With the dookie.
And taking away the shame in that, because it is normal. There is poop in your butt, and you're lucky you're in my ass. So
get over it, everybody. We got poop in our butts. Gosh darn it.
Do you douche every time you have anal sex?
On film, I douche. I never use the saline enema, because that will stimulate poop to keep coming out. So if you have an enema, I would empty it. Never put that saline in, because then you're going to be shitting for like 3 hours. Empty it, fill it with sterile water. Tap water is okay, but bottled water is better. Then while seated, not while in doggy, because again, you don't want it to go so far in that it stirs stuff up. While seated over the toilet, push it in, let it drain out naturally. And if the water comes out clear, you got it. Sometimes I'll do it one more time. But again, I have irritable bowel syndrome, so I probably have to do a little more cleaning than some. If I'm doing a really hardcore anal scene where I know I'm going to arrive at 7 a.m. and my scene isn't going to be till 3 or 4 in the afternoon, and there's going to be 4 dicks and it's going to be 2 hours long, I go to the next step, which is using my shower enema, where I clean out my entire intestine. But that process can take up to an hour. And the only reason I fuss with any of that is not because I feel shameful about people seeing feces. It's because basically our credit card companies have decided that seeing feces is indecent. And if you include that into one of your movies, they won't allow credit card processing for it. So we, as pornographers,
that's kind of fucked up.
Yeah. Oh, there's a lot of fucked up things that they do. They basically control what you watch in porn. It's really not the government at all.
And
so because they've decided it's indecent to see feces, we have to make sure we're clean on a level that would be ridiculous at home, because we want to sell these films, and we don't want to keep taking breaks if you see a little bit of something, because that's hard on the male talent. Okay, keep your dick hard while I'm in the bathroom for 30 minutes is not a sexy moment.
Is there a difference like in pleasure for the top and the bottom, as if they douche or if they don't douche, or is it just like preference, like a visual thing?
For me, I prefer, for my pleasure, I prefer not to douche, because, and that's for anal or vaginal, because it does get rid of your natural moisture. Even though you should use lube when you do anal because we have less moisture, there is mucus, in the anal canal. And if you douche out all of that natural mucus, you're just taking one more layer, a protective layer, a lubricative layer. And the drier you are, of course, you're at higher risk for tears putting you at higher risk for STIs or other bacterial infections, especially if we're talking about anal play, because of course, inherently there are bacteria in feces. So if you're not concerned about the potential of seeing that poop, if that doesn't, freak you out, I would actually recommend not douching. It keeps all that natural mucus there. It keeps your protective layer there. Yeah.
And it sounds to me too, like a huge part of comfort in sex is having a partner who understands you're human and doesn't expect you to have like, oh, there's diamonds in there. It's amazing. Like
to have porn star sex.
Yeah.
Even within the industry, whether you're in a personal relationship with someone you love, or is there also just that understanding? There's got to be within the industry, like, hey, don't worry about it. It happens. Like, is that kind of a vibe?
Oh, absolutely. So, in porn, people squirt.
Yeah.
So when you see geysers of squirt, and not just a tiny bit, it is urine. So we only have one. Right.
Always? It's not like something you put in there?
Well, yeah, some people fake it by squirting a douche in there and pressing it out. Absolutely. Yeah. But when you're not doing that, it is, when it's vast amounts, it's urine. So women can squirt. There is a tiny little gland near the vagina called the Skene's gland, and it has a duct and can create what people would refer to as real squirt. But that would be more, the volume of a real squirt would be closer to the volume of a small male ejaculate. Okay. So if you see a woman having multiple explosive, liquid coming out, it can only come from one anatomical holding area, which of course is the bladder. So long story short, we have to push to get that pee out over and over and over to make it look spurty and not just drizzle down onto our partner in an undramatic way. So when you're pressing that hard, I'd say 10% of the time a woman will poop on me. And that's fine. You're just like, girl, I'm just going to wipe it off camera.
Yeah, there's an understanding there, and it's just.
Absolutely.
By the way,
one of my friends pooped on another male talent, and he has like a sexy Spanish accent. He's like, I would eat your poop.
Oh God.
Oh.
How flattering.
Just making her comfortable. Making her comfortable like a true gentleman. I love it. I think that's important. And I'm glad to know. People were asking me, they're like, it's like squirting real. And now I know I'm not. I've been trying.
Yes and no. Yes, women can squirt. No, it can't be done in those quantities.
Okay. Noted. Good to know.
Yeah.
Noted. Is there a position that like, I'm trying to think what my question is. I'm just thinking about like topping and bottoming. Like, is there a position that works best to like get the bottom off if you're fucking them in the ass?
That would probably be, it's almost like for a man receiving, I would say the prostate would be the key. So even though the prostate is more anatomically like in the same spot than like a woman's G-spot, you still have different anatomy. All of our anal canals are shaped slightly differently. So some positions might rub your prostate more than others. So part of that is definitely individual, like playing, be like, oh, if you angle up a little more, wow, now I'm really feeling something. But hey, if you're angling down like that, it's not hitting it. So I think a lot of that, just like, when I'm trying to like coax someone into hitting my G-spot is a verbal communication thing. I don't think there's like one magical position that's like, this is going to do it, and then the length of their cock or the toy that you're using, even the firmness can make a difference. Like some people prefer a softer toy or maybe the very firm glass toy. Everyone has such a different experience with the type of pressure they need and even the depth it takes to get to that prostate,
Because I've heard that like a dick that like curves up a little bit at the end and then with the guy on top, like that's the ideal dick to hit the prostate.
Well, it's kind of like chicks because your G-spot's, at the top. So those up curved dicks are a special treat. But if you don't have one, that doesn't mean you can't get it, Even if you're as straight as an arrow, you just move your body, you know what I mean? You work it so that even though you're not naturally curving up, well, now you're at an angle that's still meeting that requirement,
Oh, yeah. And again, this comes down to having a partner you're comfortable with and that you can be like, hey, here's exactly what I need you to do right now. Here's exactly what I like.
Or even just being confident. If I'm with a stranger, like I'm there to get off, especially if I'm with a stranger. I mean, I'm glad you're happy, but I'm there to get off. So for me, and I think for a lot of women, that does take a lot of communication. Like I'm super clitoral. Mm-hmm. So if I didn't mention that to a fuck buddy that I only planned on seeing once and I had a bad experience, I feel like that would be my fault. They're not psychic. They don't know I need A, B, and C. And I think the same can be said for any sexual encounter. Maybe you love your prostate being hit. Maybe you hate it. Maybe you want your dick to be stroked at the same time by then. Maybe you want to do it yourself. Like maybe you don't like it touched at all. Like there are so many things that honestly, best practice is communication. Because if I have a bad experience in bed, it's nice to like call your friend and be like, meh, 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 meh. But like, was some of the blame on you because you didn't tell them that was your thing?
And I think that for so many women, at least I don't know what it's like for everybody, but for so many women, I feel like it's ingrained in us sex is about the man feeling good, and his ego. And so you just keep quiet and you fake it till it's over with. And that's like so many women, I feel like that's still so prevalent. So I think that message is so important. Lady, you're there to get off too.
The gender inequality is so prevalent. And you're right, our society, at least, you know, I'm 42, at least in my generation, the subliminal message given to us was that we are less important than the man and their ego is more important than our orgasm. And you know what other message I feel is given to a lot of young women? The crazy message that if you can't come vaginally, you don't have as much value. And that is false. Mm-hmm. Most women can't come with purely vaginal penetration, and that is normal.
Right. Fellas, stop finger blasting us. You're in the wrong spot, God damn it.
And again, there's a place for all of it, but like, know your body. Like my clit is very sensitive. I like it right on the button and slightly to the left. And like, I'm going to tell you, you know?
And then you talk about like communication. I want to bring it back to you for a second. You are dating someone, you've been with them for 6 years. Is that what you said?
7, yeah.
7 years. How have how has this affected your relationship with them, positive or negative?
Well, I've been in the sex industry the whole time that we've been together. So it's not like I have a comparison of before and after, but it's almost like if you started dating a scuba diver and then we're like, I hate the water, I hate scuba diving, I hate it when you go scuba diving, so you should stop. That's probably a bad partner for you. You know what I mean? So I think even in my choice of partner, their ability to be okay with my sexual life, even if I were to quit porn, is definitely mandatory for me. You know, even if I weren't doing porn, I would probably still be doing things that a lot of people would find not the way they want to live a relationship. A lot of people in America still really enjoy monogamy, and sexual monogamy just isn't for me, you know? And I'm always very open about that with my partners, and some people can handle it and some people can't. And that's fine too, you know?
And I read in previous interviews, you're openly bisexual. You've always been just really fluid with but that you said before you prefer women to men.
That's actually really interesting. So like for all of my younger years as a growing up, finding my sexuality, women, like almost the whole time. And then when I hit like my 30s, I noticed that I was dating men a little more. And I don't know if it's because I
finally grew up a little bit.
That's what I think it is. That's exactly what I was going to say. They were useless.
They don't suck anymore. Yes, it's the key.
I don't like the way this is going. Things are taking a turn for the worse.
Ladies, this is a roadmap. Women in your 20s, don't even look at men until they're 32, 33. Yes. Sold. It's a plan.
This is fake news. This is all fake news.
You're all horrible.
This is all fake news.
You're
I don't even know what to say.
Until a certain point.
I go the opposite. Maybe I'll start dating women now. I'll start dating women in like when do women hit their like sexual peak? It's like 35 or something, they say.
That's what they say.
You're like, I found it a lot younger.
I feel like I've been more and more sexual as I've gotten older, but I don't think it's my body. I think it's my brain.
Yeah.
I think it's my confidence, and I'm more and more comfortable in my own skin. I'm more and more comfortable going after my needs shamelessly. And I think that has made me more sexual, more than some hormonal moment that I've had, you know?
Absolutely. And so I'm sitting here, and I hope this question doesn't come across wrong. I'm sitting here looking, I'm like, she is so gorgeous. You look 10 years younger than me. Do you see ageism in the industry? Do you find yourself getting typecast? Because I know stepmom, hottest genre in the biz. Like, Does that bother you, or do you just embrace it and roll with it? Like, how does that work?
It doesn't bother me, maybe because I never had to transition. Like a lot of my friends who started at 18, 19, 20 and are now just getting into their 30s and mid 30s and getting those MILF roles, I think a lot of them have more of an emotional response because it's like, hey, you were good for this movie, but now you're good for this movie.
That first MILF script you get, you're like, wait, what?
Wait,
when did
why?
this happen? Yeah.
Right? But I entered as a MILF. You know what I mean? Not that I get exclusively MILF roles, but I've always been the older woman, the teacher, the secretary, the adult.
Right.
You know what I mean? Like, even if I didn't have a MILF stepmom, mommy role, I was always the adult. I was never the teen, the daughter, the kid from college, you know what I mean? So it doesn't have as much of an emotional impact on me. And I feel like a fucking adult, so I'm okay with it.
Yeah, you're like, this is pretty accurate, actually. So that's.
Do you like working with younger guys on set or older guys? Like, if you're doing like the MILF thing and like you're into character, do you want to like fuck a 23-year-old, or are you like, give me like the man?
It depends on the talent, but I tend to have a little more fun with men and women my age, which isn't to say the young people aren't fun and energetic and sexual and beautiful and supple and everything you want a younger person to be. But there's like some camaraderie.
But these ones aren't on their damn phones all the time on the TikTok, and they're ready to go. No,
it's kind of like that. And then you'll have someone your age and you'll be like, I don't know, having a conversation. And then all the teens are like not talking to each other or anyone or reading their scripts. And they're like, I'm like, hey, how's it going? Hey. I'm like, it's just a different generation, you know?
Yeah. So more of a connection there. And I also wanted to talk about, because we brought her up earlier, Brandy Love. Obviously she is a porn star icon.
Yeah.
She leans more to the right. You are also very active in politics. You announced a run for president with Coolio in 2017 as vice president. You in 2020 ran the Erection Season website to get voters to the polls. And what I loved was you said, I don't care which way you lean. I don't care who you're voting for. Get on this poll. Get over here.
And also get on the poll. Like,
right,
wait,
exactly.
are we talking about voting? No.
Both, yeah. Either one is extremely cool with me. Fan of both. But you were talking about, you know, mixing and mingling with people on set. Even within our own families, that's been hard to avoid the last couple of years. Has that been a thing on porn sets? Like
it has.
Let's not talk about it before we.
Yeah, for the first time it has. When I entered the industry 10 years ago, of course, there are people on the left and people on the right, and you'd have political discussions sometimes on sets around elections or, you know, about, you know, something, legislation that might affect pornography and stuff like that. And I think, and maybe you see this in your families as well, that even if you were in great disagreement, it didn't seem so important or contentious, right? But now I feel like the culture, even on pornography sets, is changing, and I don't like it. I feel like people are really pitted against each other. Well, I'm on the left, so I hate you. Well, I'm on the right, so I hate you. Well, you're canceled. Well, you're on my no list. And it's like, whoa,
right.
You know, to me, but you're absolutely right. What's going on in your families and in your communities and in your social media is exactly going on porn. And there are way more people in porn on the left than on the right. So I feel like those on the right are feeling probably really ostracized and canceled, I would imagine.
Yeah. I don't care if you poop on me a little, but if you're voting for them, you're on my no list. That's the new.
No, I'm really, it's not like, again, it might be an age thing, but that's just not my jam. Like, let's keep, even if you absolutely hate what they stand for, to me, isn't it important to continue to have an amicable dialogue? Because if you don't, it's just going to be us versus them. And where will we be? Like, you can't live in that polarized society comfortably. I think there needs to be some love and some understanding and some middle ground and some continued dialogue, or you're going to get the type of polarization that causes violence. And I don't mean like, oh my God, porn sets are going to get violent. I just mean like our communities.
Right.
You know? Yeah.
When what we need is sexual healing.
That's
God
right.
damn it.
Yes. More anal.
More anal forever. More anal 2021.
Yeah.
One of the final things I wanted to ask you.
That should have been my slogan.
No buts about it. Butts all the time. 2021.
Make America gape again. 2021.
There you go. That's
That's the one for all of us. I'm very down. I saw that you are also very big into the gaming.
Yeah.
Really
super nerd.
Have you always been that way, or is it like the last few years just kind of got into it? And do you like live stream? Are you doing any of that kind of stuff?
Always been into it since, I played on my dad's Atari and it was cool, but I wouldn't say that I was like into Space Invaders.
Yeah.
But the moment Nintendo and Super Mario Brother hit, like that, it was over for me. And then with the advent of the first RPGs, like even like back to Zelda or the first Final Fantasies, I like knew that I was hooked. Yeah.
That's really cool too. So truly the internet's favorite stepmom. She can help you with an ailment and play video games with you. And she knows what she's talking about with politics. Yep. Truly, you are one of the most interesting guests I feel like this has been really, really interesting. And I just love, I feel like so many people, especially circling back to the physical therapy, so many people suffer mentally and physically from sex lives that they know could be better, but they're too embarrassed to seek help for. I love that you talk about it in such a matter-of-fact, shameless way that would do so many people so much good. I hope that becomes a more and more common attitude. I hope you follow that goal of opening that up and starting that.
You need to do that.
I think it can be. We're socialized into that shame. It's not inborn, so we can absolutely be socialized out of it.
Yeah, I would definitely love to see that. And where can people find you? Where can people look you up? What's the next big thing?
I know. So I have all of the things, but let's just go with Instagram. So Instagram is my name, Cherie Deville, and then XO, because I keep losing my Instagram and that's where I'm at right now. my Twitter is Cherie Deville, and my TikTok, I'm probably the oldest person on the app, but my TikTok, believe it or not, is also Cherie Deville XO.
Very cool. And are you doing the OnlyFans thing right now?
I am doing the OnlyFans thing. It's awesome. Yeah. Online really hoeing for quarantine is where it's at.
Hell yeah.
Online hoeing for quarantine. How's the business been on OnlyFans? Do you have a ton of people getting
Thank God. I just started mine because I've always done a lot of content, clip stores, premium Snapchat, all of that stuff. But my focus pre-quarantine was on shooting for other companies and then shooting for myself some. But when basically we couldn't shoot for other companies, I decided that I was going to really invest my time into the OnlyFans, and it's been awesome. My fans are awesome, thank God, and have definitely got me through this quarantine. Yeah.
Very, very cool. So that's very good. And also you have recent porns in the beginning of COVID. Because I am admitted, I mean, how many episodes have I said on here now? I'm a porn lady. I love him.
She loves Owen Gray. That's
I'm
her
a big
guy.
Owen Gray lady.
Oh, he's
yes.
And like, I don't know if you can tell from his videos how he is in person, but he is so smart. He is so nice. And it's intimidatingly large, but he knows how to use it. And he loves to communicate. Sensual, romantic. He's really cool.
Easy K.
Do you see how red my face is?
Her face is bright
This is
red.
what I always say about him. I always tell my friends, like, why do you like him so much? I'm like, you can tell he cares if she gets off. It's so rare. It's so rare.
No, he genuinely does.
Yeah.
That is correct. That's not an act.
You know it when you see it. As an expert myself, the guy. Yeah. This is confirmation that I'm on the right
time. Like if it takes, he's not even about the scene. If it takes 20 minutes for you to get off from him touching or licking you, that's what's going to happen. He's not going to be like, let's flip into pile driver because it looks good on camera. Like he's really cool.
That's my guy. Oh my God. Oh my goodness.
You need me to finish this one out?
Yeah.
You're at a loss.
Where am I?
I'm just
my hormones are going crazy.
She is sweating. The face is red.
My face is red.
Well, thank you. We really do appreciate you popping on. And like Kate said and mentioned, it's so nice to have someone who can talk matter of fact about subjects that people still think are taboo, which I think in at least the gay community, anal sex, even though it's a pillar of our sex life, is still something that people are embarrassed to talk about. So
Yeah.
to have someone on who does it, who knows about it anatomically and all this, I think it'll do some people well. So thank you
I put
again.
all my body parts in it. You know, I'm just comfortable.
Yes.
I'm in it.
I love it. I love it. I love it. Cherie Deville, everybody. Give her a follow. Cherie Deville XO on Instagram and find her on OnlyFans everywhere else.
Thanks,
I'm a huge fan.
Thank
I'm all
you.
in. Thank you.
All right. Thank you so much, Cherie.